viewers, I am Arun. Welcome to the Facebook live session with VS Hospitals. Today's topic is scars. Don't let them scare you. Scars are a natural part of the body's healing process. A scar results from the biologic process of wound repair in the skin and other tissues. Most wounds, except very minor ones, result in some degree of scarring. Scars can result from accidents, diseases, skin conditions such as acne or surgeries. Today, we have with us a renowned plastic and aesthetic surgeon with over 18 years experience, Dr. Sathish Manivel. Offers an array of cosmetic and reconstructive treatments with customized and personal care. He keeps himself updated by learning the latest cutting-edge technologies from the workshops and conferences he attends. Welcome, Dr. Sathish. Thank you for joining us today.
Good evening to all the viewers. I am Dr. Sathish Manivel, plastic and aesthetic surgeon. I'm overjoyed to talk to you all on this evening regarding scars. It is a very challenging topic, even though it is very common. It is something which bothers almost each one of us. So I will be trying to answer few basic questions and try to clarify some of the common doubts that you might have. Thank you for having me.
Great, Dr. Sathish. Let's start off with the questions. What exactly is a scar and how scars normally form?
Okay. So a scar is basically something which happens after an injury to the skin. So as some primitive creatures have what is called as a regenerating capacity, meaning to say that when there is an injury or a wound, they regenerate what has been lost. But humans and other animals or birds, they do not have this regenerating capacity. So we heal the wounds by forming what is called as a scar. So what is this scar exactly? It is basically what we call as a fibrous tissue. So basically, when there is an injury to the skin, the body has to heal because skin is a protective layer for the body, and the body has to close the wound and heal it. It cannot produce skin, so it forms the next best thing, which is a layer of fibrous tissue, which is commonly called as a scar. So how does it form? As I explained earlier, when there is an injury, the skin has got many layers. The first layer is called as the epidermis. Within that, there is a bigger layer which is called as the dermis. So this epidermis is the topmost layer. When that is alone injured, the body usually reforms the epidermis. So scar is not formed much. Whereas the bottom layer of the skin, which is the dermis, which gets injured, then the body does not have the capacity to produce this dermis. So instead, it initiates a reaction which is called as the inflammation. So this inflammation takes many weeks and recruits lots of cells from the body, especially what we call as the fibroblast. This fibroblast produces the fibrous tissue and ultimately heals the wound by bringing the edges of the skin together. So that is how scars are formed in our body.
Dr. Sathish, for educating us, what are the facts that we should know about scars?
Okay, that's an interesting question. The very common thing that a common person has is something called as scarless surgery. So whether we can, by doing a plastic surgery, we can totally make sure that there are no scars. That is what everybody thinks about and expects. What is there? The fact that we have to understand is, like I said before, humans don't have the capacity to regenerate what is lost, except for very few tissues. So scar formation is compulsory when there is an injury. So that is the number one fact that we have to understand. So scar is compulsory in healing a wound. There is no option like there is no scar at all. What we generally mean by no scars is minimal scars. The scars would be as minimum as possible, as hidden as possible, so that in a quick glance, it is not visible to the eye. So this is the most important fact that a person has to understand regarding scars.
Dr. Satish. What are the different types of scars?
Okay. So, this is a very interesting question. I do not want to go into the medical aspects of what different types of scars are there. Because from a layman point of view, there are only two types of scar which I can think of. One is a good scar. The next is not that good scar. That's how people think. So what do we mean by a good scar? Like I said before, scar is going to happen. There is no option like there is no scar. So what is a good scar? A good scar is basically we have normal lines in the body. Like for example, in the forehead, or there can be some lines that can in the face. So if the scar is along the direction of the lines, and if the scar is a thin line, and if the scar is in the same color of our skin, then that is called as a good scar. So meaning to say that if there is a small thin line along our skin creases in the same color of our skin, then it is almost like it's invisible. We won't be able to see. So that is what we called as a good scar. So what is the opposite of it? It is not a good scar or an unfavorable scar. So unfavorable scar will be just the polar opposite of a good scar. So what can it be? It won't be a thin line, it will be a thick line. The next thing, it will not be along the skin crease, it will be perpendicular or at an angle to the skin crease. The third thing is the contour. It will not be on the along the skin surface. It will be either higher to the skin surface or lower to the skin surface. The fourth thing is the color. If the color of the skin and the color of the scar is not matching, either it is darker than the skin or lighter than the skin, then it becomes obviously seen. So when all these things form, it becomes an unfavorable scar. So basically from the patient's point of view, there are only two scars, a good scar and unfavorable scar.
Easy to understand, Dr. Satish. Thank you so much for that. What are the signs and symptoms of a scar?
Okay. So the most common symptom that the patient comes with in a scar is, like I said before, a not favorable scar. So what can be the symptom that can they have? It can be either because of the appearance, or the scar per se can cause some troubles to them. Appearance, what is the thing? It can be in a place where it is obviously seen, either because it is very thick, or it is raised from the surface, or it is dark or lighter in color. So obviously it is very easily visible to the eye. So that is the most common symptom that the patient comes. What other symptoms can they come is, sometimes there can be some pain, some itching that can happen in the scar. Because some types of scars are, we call it as when the body produces more fibrous tissue. Like I said before, scars are formed from fibrous tissue. When the wound heals, the body has to stop producing any further fibrous tissue. But for some unknown reason, the body keeps producing lot of fibrous tissue and the scar becomes too big. In that case, the patient can have some itching, some pricking pain. There can be a lot of redness in that area. So those we call as hypertrophic scar. So this is another symptom which the patient can come. The other worst form of scar is what we call as a keloid scar. In keloid scar, basically what happens is the injury or might be in a small area, but the scar will become much bigger than the area of the injury. That is, it will go into normal skin, invading into normal skin, almost like a cancer-like behavior. We can't call it cancer, but just to make it understand, a cancer-like behavior. It goes into normal tissue. In those cases, the patients might give the symptoms of it was a small to begin with, but it is keeping increasing. So that is another symptom that we. So what are the signs when the doctor examines? We can see whether the scar is thick or thin, whether the scar is flat or it is become higher than the surface, what is the color of the scar, and whether there is any redness, whether the scar is confined to the skin or it is going to other places. All these are the signs that the doctor perceives. And based on that, the plastic surgeon comes to a diagnosis. What is actually the problem? An unfavorable scar is a general term. But when we go to a medical diagnosis, unfavorable scar has got many diagnoses. So we have to come to the diagnosis, and based on the diagnosis, the treatment has to be
Uh, how about stretch marks?
okay. So this is another common thing that a person is worried about. So when do we get stretch marks? So when there is growth in a particular area, the skin, when the growth is gradual, the skin has got some fibers called as the elastic fibers. It is something equal to what we have in a balloon or a rubber band. So it's elasticity. But when the skin grows suddenly, what happens is there is break that happening in the skin. The elastic fibers are not able to cope up with the growth. So there is some small breaks that happen in the skin, and these are called the stretch marks. So where is it commonly seen? In growing areas. When we see a teenager, suddenly there will be a growth spurt. If we see this year, they will not be that tall. But within 1 year, 1.5 years, they would have grown 4 inches or something. So we can see stretch marks happening in their backs or in their shoulders in that area. Another common place where we get stretch marks is from pregnancy. Within a span of 5 months, 6 months, the abdomen suddenly becomes bigger. So the skin is not able to take that strain. The elasticity is not there. So what happens is small breaks happen in the skin. So when the pregnancy is over or something, when you just imagine a balloon, a balloon, when we blow it, it becomes bigger. And once the air goes out of the balloon doesn't go back to its original shape. There is always some lag. So because of that lag, the stretch marks are almost permanent because they are caused by injury, and they are small scars that happen there. So those are stretch marks.
Dr. Satish. Dr. Satish, what are the emotional effects of scarring?
Okay. This is totally a variable thing because emotion is such an individual feeling. So there are people who might feel that a scar, it's there, it's okay. If I have an injury or if there is a surgery, a scar is common, fine. There are people who might be very scared to have a treatment, or they'll be, when they have an injury, the first thing that comes to mind, oh, I got an injury, and is it going to have a scar? So emotional aspect is something which every doctor has to be aware of, and it is not just about treating the patient. What is their mind in respect to the scar, that has to be understood. We have obviously we need not uh, elaborate too much that when there is an injury to a face, we are so worried about whether that will be a permanent scar in our face. In addition to that, there are some areas in the body which, for example, if we get a scar in the right hand is an area where when we go, people, we greet by having a shake hand or something. A big scar on the right hand, people might be a little conscious. So the emotional aspect basically happens because of that particular individual, how much they are worried about the scar and the place where the scar happens. A scar which is a much more in a hidden place, it is not, patients are not that much emotionally. So whenever there is a scar or an injury that might lead to a scar happening in a place which is obviously visible, then we have to expect some amount of emotional thing happening to the patient, and that has to be addressed so that a holistic care happens to the
Dr. Satish, how do you diagnose scars?
patient. Okay. So when we see a patient with a scar, obviously, like how we said, they come with symptoms. They say that this is what is worrying me, and sometimes they might say that it is itching, or it is causing some problems. So those history is very important. What is the duration of the symptoms, and what is that is bothering them? So based on that, then we examine what is the findings that we see. Where is the scar? How long has it been? Is it just in that area of the injury, or is it gone beyond the area of injury? So based on that, we come to a diagnosis of whether it is a favorable scar or an unfavorable scar. That is the first thing. If it is an unfavorable scar, why is it unfavorable? Is it because it is depressed? Is it because it is hypertrophic? Is it because it is causing any difficulty in movement or anything? Is it because it is disfiguring a part of the face? So based on that, we can come to a diagnosis of an unfavorable scar. The next thing which we have to diagnose is a keloid. Now, keloid is something, like I've said before, it is something, it grows like wildfire in areas which is beyond the injury. So this is a very difficult problem to treat. It has to be, and it causes a lot of emotional problems to the patient. So this is a very challenging thing. There are lots of treatments available, but still our understanding of a keloid, I would say, is not to that extent as good as understanding other common things. So, but some very good options for treating keloid are coming, and all treatment option success happens only when we do a right diagnosis in the beginning itself. So diagnosis, that's how we diagnose, and based on the diagnosis, what is the plan of treatment has to be discussed.
Satish, suddenly one question pops up. What if scar is not treated on time, and if ignored, where does it lead to?
Okay. So, like I said before, the scar formation happens in the body. It is the body tries to heal the wound by forming a scar. So, initially, maybe in the first 3 months or so, uh, the scar is called as an immature scar. Like it has not completely settled down. After a few weeks or months, we call it as a mature scar. So in the period where it is immature scar, the first 3 months of healing is when all the scar treatments has to be started. Maybe if they miss the bus in 3 months, 3 to 6 months is also okay. But usually more than 6 months, or definitely more than a year, majority of the treatments are not that effective. So whenever a scar is expected or an injury happens, the treatment is much more rewarding if it is started early, especially in the first 3 months of scar formation.
For clarifying that, Dr. Satish. Are there any home remedies to reduce scarring?
Okay. The first thing is we have to make sure that we follow the doctor's order. Whenever there is an injury or anything, we have to keep the area clean and make sure that there is no infection happen. A proper eventless healing is the first step to get a good scar. So at home, we have to make sure that the wound is kept clean and there is no contamination or anything that is happening. That is the first thing. And then once it heals, a common moisturizer or olive oil or any foam things can be applied over the scar and a gentle massage can be done. Most of the times, this kind of moisturizer and massage itself would be sufficient to make the scar mature and settle into a fine line. So I think these it doesn't matter what kind of moisturizer we are using, but some moisturizer and massage is the basic thing in the home that we advise all the patients to begin. This is always given as a first step, and in case some patients have the tendency to form more scar, then only we go in for more medical treatments for the scar.
What are the latest treatment options available now, and is the treatment cost effective?
See, as far as treatment is concerned, we can divide it into two things. One is without surgery, the next which involves surgery. Okay. Initially, for all the scars, we try treatment without surgery. The first thing which we start is, like how we said, moisturizers and massage at home. Majority of the patients settle well with that. We teach them how to massage. That is more important. It is not just massage, but the direction of massage and how long the massage has to be done. What is the pressure that needs to be applied? This is more important. So once we do that, and in case it requires much more, there are some ointments and gels available for the scars. This is the first step which we do. And the next step is giving some what is called as a patches. We give these patches when their scar becomes slightly thicker in the first 2-3 weeks itself. Beyond that, the next step comes minimal invasive. Like these ointments, patches are not invasive. Then comes a minimal invasive. Some patients might not respond to the initial patches or ointments. In that case, some injection like steroid injections, low dose steroid injections might be needed to give it the scar. Sometimes some treatment, some advanced treatments for different kind of injections called PRP injections or laser treatments are also available, which will give it, when given on multiple sittings, can make sure that the scar gets settled in a quicker time. Coming to the surgical treatments, what are the surgical treatments? When the scar becomes quite old, like 6 months, 1 year, then all these non-surgical treatments won't be effective. Then after 1 year or so, the only option that is left to improve the scar is only plastic surgery. So in plastic surgery, there are many types of plastic surgery. Basically, we have to remove the scar and we have to make sure that the scar is converted from a unfavorable scar into a good scar. That is a thick scar which has got a different color or which is against the skin crease lines has to be converted into a thin scar along the skin crease lines, preferably in the favorable color. So this procedure is called scar revision. So this is a generalized term. So many different technical aspects are there in plastic surgery on how to achieve depending on the scar. Another thing that is coming up is whenever there is a scar, then there is always some amount of loss of fat. That is, there is a skin, and below that skin is called the fat layer. Fat also there is a loss. So there is something like a bumpy appearance with the skin. So this we are correcting by what is called as a nano fat injections. So these nano fat are basically very, very small fat globules. We take fat from the patient and we, through a process, we reduce the size of the fat and make it under the small, less than 1 millimeter size of fat, and we inject that into the scar. So this is believed to correct the ups and downs in the scar, and due to some addition of what is called as a PRP, that is platelet-rich plasma, when we combine it with this nano fat grafting, so it increases some growth factors and ultimately causes a more favorable scar. So these are the lots of surgical options that are available, but these surgical options are usually done when all the non-surgical options are exhausted. Now coming to the second part of your question, how cost effective are they? like I said before, majority of the patients might not need all this. They might only need some home remedies like moisturizers and teaching them what is the right way to do a massage. So it is not that much costly, obviously. Then the next step would be giving some patches, silicone patches. Those are really cost effective because the benefit which they give when compared to preventing any surgery later on is much better. When it comes to treatments, slightly more advanced treatments, slightly minimal invasive like lasers, then it requires multiple sittings. And each sitting might be a little expensive depending on what kind of laser we need to use. And then surgical aspect, obviously it is slightly more expensive than non-surgical, but when surgical treatments are required, that becomes the only option available. So in that case, we might have to decide on which is the best surgical option, which is the more cost-effective option. Lots of options are there that has to be discussed with the patient, and each might have an advantage or disadvantage. So ultimately, a cost benefit discussion has to be done with the patient.
Very elaborative, and thank you for explaining to us step by step, Dr. Sathish. Does insurance coverage apply to scar treatments?
It's a very important question. Okay, so there are lots of thoughts going that plastic surgery is not covered under insurance, so would it be covered or anything. What I want to just inform all our viewers is whenever they take a health insurance, it is better they tell all their past illness. So all their past illness has to be given in writing, and after 2 years, all these pre-existing would be covered. So when it is not said earlier only, then it becomes a problem. That is the first thing which I want to say. And coming to the scar aspect, whenever, as per the rules in the insurance, whenever the scar is because of an injury or burns or any previous surgery, and if that scar is causing problem to them, that is covered under insurance. So a patient can very well apply for insurance and get the scar corrected if they have already submitted that they have a problem, and they have this scar is because of any previous injury or burns or any surgery, it is definitely covered under insurance.
What is your take-home message?
So the take-home message is you don't have to be scared about scars. That's the first thing like I want to say. Like all illness, if the scar is taken into consideration from day one, and whatever treatment that needs to be done, if it is discussed with your surgeon and all those treatments are given, there is a high chance that you will have a good scar. So, and in case by some reason that we are not able to treat the scar initially, the time goes away. Lots of advances have come in today's medical field, and it is not that you have to always be with the scar lifelong. And medical science is advancing in a very rapid pace. There is something which is coming up, which is called as fetal healing. So this fetal healing is basically when we know what is a fetus. It is the baby, unborn baby. So the unborn baby doesn't have a scar. Whenever there is any injury that happens, it doesn't have. So when after we are born, we lose this ability. So much of advancement is coming in stem cells and all those things. So what I want to say to my viewers is, you don't have to be worried, and it's not that you don't have to always have this scar for the rest of your life. Lots of options are there. Consult with your doctor. Definitely, you will be able to get a good remedy.
So much for your valuable time, Dr. Sathish, for taking time out and educating us on scars. Viewers, some scars fade over time. If yours doesn't and it bothers you, treatments can make a scar less noticeable. Talk to your doctor to find out if any of the treatments would be right for you. Letting a trusted plastic surgeon know how you feel about a scar can help you feel a lot better about it. Next Thursday, let us catch up with an acclaimed radiation oncologist with 42 years experience, Dr. P. Balasubramanian, on an important topic, cervix cancer, what women should know. Till then, thank you. Take care. Thank you so much, Dr. Sathish, for joining
Thank
us.
you.